Pioneers in weight loss surgery. KularHospital.com, Ludhiana, Punjab.
So, Mr. Sayyid
Anwar Habib.
Anwar Habib.
Yes.
Good. So, how did you find us?
Actually, I've seen lots of videos in the internet, and then I have decided to come here.
Okay. So, what made you, take this decision to come here, all the way leaving aside the big cities? Like I know most of the patients from Bangladesh are going to Chennai or other big hospitals in South India. So, what made you decide to come all the way to Punjab on the other side of the country?
Actually, regarding bariatric surgery, MGB, Mini Gastric Bypass, I have searched in internet and found that Kular Hospital is the best hospital.
That's what you
Yes.
derived from
Yes.
the internet. Bariatric surgery is more or less a kind of designing thing because from the inside, what we want to do is decrease the size of the stomach. And then I can measure, like if this is the stomach, decrease the size. And this is the intestine. And we can run whole of the intestine and see how much we have in hand and how much safely we can bypass. Because we don't want that long intestine.
Right.
That's the main problem. We have been all hunter-gatherers. We were in the jungles running after the animals. So our design has gone to be old. Actually, that is the main reason why we start gaining weight. It's not only your diet, because let us be very clear that human animals are the most intelligent animals on the earth. So my understanding of obesity is that 80% it is something which is beyond your control, and 20% is something which you can control. But if you don't let your weight go up too much, then it will be always under your control. But if it so happens, because of some reason, it has increased significantly, then you are caught in an axis, cannot get out of it. Because we need to understand morbid obesity is a disease. When we talk about medical health, I am telling you that it's a bit of designing actually. Why? Because when bariatric surgery started, we were all thinking that probably all these obese patients are eating too much. Obesity was considered to be a character flaw. And that is how the doctors tried to fix it. First of all with jaw locking, and then internal locking like gastric band or sleeve. But now we understand that the locks are not successful. Because again, this human animal is very intelligent. He can cheat the locks. If you cannot eat healthy, you cannot eat solids, I put you a band inside and you can eat only this much. You can cheat it. You can take soft drinks. You can take alcohol. There's so many things which will give you happiness because you're getting calories. So as far as the designing goes, when I learned this in US in 2000, when I started with the basic procedures like gastric sleeve or Roux-en-Y gastric band, but in Punjab, our Punjabi population is used to the chapatis because they have been working in the fields. It's in our head. And small pouches cannot take 2 chapatis. And a human being cannot change the lifestyle completely. We can modify it a little bit, you cannot change it altogether. And that is the reason how I came into this field of mini gastric bypass and I switched from the old procedures because we want to see happy patients. Like you had 1 chapati today?
Yes.
Within 7 days, 7, 8 days of yours? Yesterday?
Yesterday night.
So without any vomiting?
No.
No vomiting in 7 days. So that's what we want. And how much you lost in these 7 days?
5 kg.
5 kg. So that is what exactly we want. So it is a combination of some decreased absorption because we have given you a 6-feet bypass. It is pushing your fat out of the body, but you have the luxury to live a normal quality of life like any other person. If you're sitting together eating no one would be able to make out whether you had any surgery or not. And the foremost thing is that if you cannot eat, then you will be depressed. Because we don't eat just to fill our tummies. We eat to satisfy the upper story. And if this is satisfied, then everything is good. So that is what mini gastric bypass gives you. And this is what I learned from Dr. Rutledge. I was talking about the customization thing of bariatric surgery, and that's how we got connected in an international conference. And then I met Dr. Rutledge, and then I actually relearned everything by going to his center in US in Henderson. In 2000, he was there in Las Vegas, Henderson, St. Rose Dominican Hospital. So, and then I could make out that we need to make bigger pouches, bigger outlets, so that you don't have any vomiting. And this is a low pressure system.
Right.
This is what I'm talking about, the customization, designing thing in bariatric surgery, because it's all about eating. And if you cannot eat, and if you're feeling nauseous all the times, you will not be happy. We don't want to lose weight at the cost of, this thing which would disturb you altogether. This is number one. So in designing, I have worked so much. If we see an old patient who has got different habits, because he is not taking chocolates and candies and cold drinks and McDonald's and pizza, because in his time this was not common. So his habits are entirely different. His reason for gaining weight is entirely different. So we'll give him a different design. And then I see a wrestler, a kabaddi player coming. He has been eating like 15 chapatis in one go. I need to decrease his stomach by 10 times. But on the other hand, I get a young lady who is only 90 kilos, but she's taking only one chapati, maybe only this much of food. She's most of the times in a dieting mode, but off and on she takes some candies, chocolates, cold drinks, and pizzas, burgers. So we need to give her a longer bypass so that she absorbs less. If I just work on her volume, make her tight by 10 times, she will be depressed, because we need to eat at least a moderate amount of diet. So that's what customization is all about. My patients wanted to have at least some luxury, and then came the other things. And now we know after 20 years that the big outlet, not only that it gives you less nausea, even after 10 years, the pouch does not dilate too much because of a low pressure system. So this designing is a little bit loose designing. Less nausea, vomiting, less pressure, less chances of leak, which is the deadliest complication to have after bariatric surgery. And if the pressure is not building up, but if the outlet is wide, like in mini gastric, that is a little difference in designing. So that is why we are not worried about the leaks, although it can happen, but the chances are very little. So, and especially when you are going back to your country after 10 days, what if you have a leak there? So the late leaks are not reported in mini gastric bypass. The reason is big outlet. Because once healed, like today we took out the staples, and we checked your internal system by giving you that drink which was visible on X-ray. Can you show that barium? If I say the chances of leak are 1 in 1,000, it's a safe procedure. And if you see in this picture, this is the contrast study which we did on you. This is your food pipe.
Yes.
The food is coming down. This is the stomach. This is the stomach, and this goes your intestine. This is the joint, the bypass. See how fast it's going down without any obstruction. There is no band, there's no ring, no lock system. So if it's going down, there's no pressure. Why it would leak? And in MGB, if at all a leak happens, it will be visible in first 3 days. That is how we discharge the patient after 3 days. So after that, once the healing has happened, then there should be no leak. In the long run, to avoid ulcers, don't smoke.
Okay.
Nicotine, tobacco, those things are not good. They can give you ulcers. Or taking a lot of painkillers like Tylenol, Advil, diclofenac, ibuprofen, all the big white colored painkillers generally available on the counter. Allopathic medication can give you ulcer. Not if you use it once in a blue moon, but if you take it regularly. And it hurts, you'll come to know that you have gastritis, disturbance here, or it can even affect your liver and kidneys as well. So the painkillers in the long run are very bad, and if at all you have to take painkillers because of some reason, then the best would be to take opioid painkillers, which are synthetic products like opium. So buprenorphine patch is available these days. You can ask your doctor if, like, sometimes patients having knee pain or backache or a disc problem, he or she has to take it for 6 months, then the patches are very good, buprenorphine patch, or even the tablets. You can take the tablets of the same product, it's available. So that's really very safe. So this is all about painkillers and tobacco, smoking, causing ulcers. Long run, you can have deficiencies. See, one person is going to get out of your body. So we want to see that whatever is left behind is fully energetic, and your face should be shining and no deficiencies. And then how to handle it. Because you'll be eating less, but eat healthy. How much you had today? You had one chapati?
Today no.
Yesterday? One chapati. What was the size? This big size?
Yes.
Okay. With some dal or something?
Dal and sabji, vegetable.
So in the beginning, I would suggest you should take more of dal, sabji and curd, because that is proteins, that is nutrition. Chapati will give you satisfaction, but it's not nutrition. So chapati should come last. So first of all, you take dal, curd or some vegetable, or if you're taking non-veg, that's even better. You can take anything, mutton or chicken or fish. Yeah, so that's even better. It has got more amount of proteins. We don't want you to lose your weight at the cost of bones and muscles. That's the main thing. You should remember. And get your blood test done every 6 months, at least for the first 2 years, and after that every year, for ever. And keep taking your vitamins. And if you have any disturbance here, go to your doctor, tell him he can do endoscopy and see inside if there is any ulcer or not.